Good day, class. This lecture is an overview of the human infectious diseases. Since this is just an overview, more of the infectious diseases will be tackled or discussed in the next lectures. Okay, so to start, as you can see in your SAS Module 24, human diseases fall into many categories. It could be metabolic disorders, neoplasms, nutritional, psychiatric, infectious diseases, degenerative diseases, and immune diseases. However, in this lecture, we will tackle or focus only on infectious diseases. I also apologize in advance if there will be disgusting images or pictures in the succeeding slides. This is for us to understand better and to picture out better the different infectious diseases. Infectious diseases or diseases caused by pathogens or disease causing microbes that follow colonization of the body site by the pathogen. What does it mean? These pathogens inhabits the body and not just one anatomical site of our body. It can also move from one body site to another during the course of a disease. It can cause diseases simultaneously or one to another. These pathogens proliferate and eventually causes diseases. Infectious diseases are caused by your microbes. It could be your cellular microorganisms, the bacteria, the parasites, and fungi. It could be as well your acellular microbes or infectious particles, the viruses, and the prions, which actually causes infectious diseases to our body. The different anatomical size of our body. It could be your eyes, your ears, your skin, your respiratory system, your oral cavity or your mouth, your circulatory system, your gastrointestinal tract, your genitourinary tract, and your central nervous system, which we will tackle in the succeeding slides. Just a quick recall, pathogenic diseases could be an infectious disease or a microbial intoxication. When you say infectious disease, again, a pathogen inhabits your body, proliferates, and eventually cause a disease. For example, you have their methicillin-resistant Staphylococcus aureus infection and gas gangrene. Gas gangrene is caused by a bacterium, your Clostridium perfringens. Microbial intoxication, on the other hand, in here, you were able to acquire the toxin of the pathogen outside the body, or that's in vitro. It's either you were able to ingest the toxin and eventually it caused a disease to your body. For example, staphylococcal food poisoning, which is very common, and another is foodborne botulism. Foodborne botulism can be acquired or we can get this from improperly prepared or preserved canned goods that is actually caused by a bacterium Clostridium botulinum. So that is the difference between microbial intoxication and infectious diseases. But going back, let's focus on infectious disease. Before we start with each anatomical sites, which this or organisms or microbes causes infectious disease, we will first know what itis means. So words ending in itis refers to an inflammation of a particular anatomical region. When you say inflammation, it's not only caused by an infection or infectious agents, it can be caused by other factors such as toxins, chemicals, and injuries. Okay, inflammation, there is redness, there is swelling, there is as well as pain, and you will be experiencing increased heating in the area, and eventually, or at some point, there will be loss of function or loss of its normal function. So itis means the suffix itis means inflammation because we will encounter more of its word later in the succeeding slides. So let's have the first anatomical site that can be invaded by infectious agents. We have our skin. Skin is actually your lifetime coat. It serves as a physical barrier. It acts as a protective covering of our body, making it a part of body's first line of defense. Okay, I'll not discuss more of its anatomy, just a quick recall of the three main layers of the skin. You have the epidermis. So as you can see, the epidermis is the outermost layer. It's composed of epithelial cells. It's the outermost protective shield of the body. So that's the outermost layer, okay? Next is the dermis. The dermis is the bulk of the skin. It is composed mostly of fibrous connective tissues. This is where your sebaceous glands are found, as well as other blood vessels, the lymph. This is the only vascularized layer, your dermis, okay? Next is subcutaneous layer. Your subcutaneous layer is also known as your hypodermis. This is where fats or adipose tissues are found. Okay, so again, the three main layers of your skin, you have the epidermis, the dermis, and your hypodermis. So to maintain the homeostasis of our skin, you have your indigenous microbiota. Your indigenous microbiota are previously called your indigenous microflora and normal flora. Even until now, we are still calling this as normal flora. These are your bacteria that already lives in your skin since before to help maintain or balance the uh, the cells of our skin. Okay, then you have next is low pH. When you say low pH, that means weakly acidic. This is to fight against pathogenic bacteria as well as to maintain an optimal acid environment in order for our normal flora in our skin to survive. Lastly, these chemical substances, the lysozyme and the sebum. I already mentioned sebum in my earlier slide. Lysozyme is an enzyme. It is found in many bodily secretions like your tears, your saliva, and milk. It also acts as a bactericidal agent to fight against pathogenic bacteria. So these substances or microbes and the pH are very important to maintain the homeostasis of our skin. Therefore, loss of homeostasis will eventually lead to different diseases or inflammation. So it's very important that these are actually balanced and maintained. First, we have skin infections, dermatitis. It's the inflammation of the skin. So first, skin infection. We have hair folliculitis. This is an inflammation of the hair follicle. Again, the hair follicle, that's the sac that contains a hair shaft. Okay, there is an inflammation. This is how it looks like. I have here examples of folliculitis. You have here ecthyma gangrenosum. Most of ecthyma gangrenosum are caused by bacteria. Particular, you have your Pseudomonas aeruginosa. Another is this is a malassezia folliculitis. This is caused by a fungi. Okay, so these are examples of your folliculitis. Next is thigh. This is an inflammation of a sebaceous gland that opens into a follicle of an eyelash. So I have here the picture. This is how it looks like. This is caused by a bacterium. In particular, this picture is caused by a staphylococcal bacterium, and this is actually how it looks. I guess most of us experienced this when we were young, or is it just me? I experienced this when I was young. This is really irritating and very painful. Okay, so this is thigh. Next is furuncle. This is also known as boil. It usually results from folliculitis. This is a localized pyogenic or pus-producing infection of the skin. When you say localized, this is only in a specific or in a limited area, and this is how it looks like. This is your furuncle. Next is carbuncle. Your carbuncle is somehow similar to furuncle. This is a deep-seated pyogenic or pus-producing infection of the skin. Usually, it arises from many furuncles or coalescence of furuncles. When you say coalescence, these are joined together furuncles. Your furuncles and your carbuncles are actually caused by a staphylococcal infection. So this is how it looks like. It's so painful to look at, and these are the pus, and it's swelling and inflamed. So this picture facing your computer is macule. Macule is a surface lesion, meaning it's only in the surface of your skin. It's neither raised nor depressed. So this is how it looks like. You can see this in measles patients. Measles is caused by a virus. So it's caused by rubiola virus. So again, this is your macule. So next is papule. Papule is a surface lesion. This time it is firm and raised. If macule is neither raised or depressed, this time your papule is firm and raised. It's not depressed but raised. As you can see in the picture, you can see these lesions in chickenpox patients. I guess all of us or most of us already experienced this when we were young. This is so itchy and at the same time painful. So this is your papule. Next is vesicle. It's a blister or small fluid-filled sac, and you can observe this in chickenpox and shingles patients. Okay, as you can see in the picture, it's a vesicular fluid. It has fluid inside the vesicles. So this is also painful and itchy at the same time. Chickenpox and shingles are caused by the same virus, your varicella zoster virus, your chickenpox by varicella, and your shingles by zoster. So months to years later, during periods of relative immune suppression, or if the patient is really very immunocompromised, varicella zoster reactivates to cause zoster, and that's already your shingles. So shingles only happen to those very immunocompromised patients. So going back, this vesicle skin infection, you can be able to observe this in chickenpox and shingles patients. Lastly, we have here pustule. It's a pus-filled surface lesion. It's actually a pimple or a bigger pimple. If you can see in the picture, it also has a pus inside. Pustule is affected by many factors, but mostly it's caused by a staphylococcal infection. Okay, so this is your pustule. So those are few of the skin diseases or infections caused by infectious agents like bacteria, fungi, and viruses. So lastly, I'll just show you this picture. This is from Burton's. I guess you have a copy of that book. Letter A here is macule. As you can see, it's neither raised nor depressed. Okay, meaning it's not raised, it's not depressed. Okay, letter B is a papule. It's firm and raised. Okay, vesicle, this is a vesicular fluid. It contains fluid inside that sac, as you can see. And lastly, your pustule, these are your pus filled surface lesions. So again, these are your skin infections. Let's proceed to the next anatomical site. So that's the ear. This is the anatomy of the ear. There are three major layers of the ear. You have the external ear, that's the outermost part. the middle ear and the inner ear. Your external and middle ear structures are involved with hearing only, while the inner ear is involved in both the equilibrium and hearing, and this is actually extremely complex. Okay, I'll not discuss the whole anatomy of the ear, but this is how it looks like. So there are three pathways for pathogens to enter the ear, causing ear infections this time. So we're already in the ear infections. We're done with skin infections, okay? Are you still with me? There are three pathways for pathogens to enter the ear. One way is through the eustachian or auditory tube. You go back to the picture, the previous slide, for you to picture out better um, the structure of the ear. So that's from the throat and the nasopharynx. It could be also from the external ear, or it could be via the blood or the lymph. Okay, so in here, through the eustachian auditory tube from the throat or the pharynx and the nasopharynx. So when there is a bacterial infection in your pharynx or throat and the nasopharynx, it causes rather your eustachian or auditory tube to close. So bacteria are trapped in the middle ear. Okay, in what layer? They are trapped in the middle ear, allowing facultative anaerobes, meaning those bacteria that can survive without oxygen. These bacteria actually proliferate, and eventually they cause swelling and damage of your ear, or causing infections. Okay, so these are the three pathways for pathogens to enter the ear. So you can proceed to next slide after taking a look on this slide. So these are the ear infections. You have otitis media and otitis externa. Otitis media is the infection of the middle ear, while otitis externa is the infection of the outer ear canal. So if you can see, there are pus in it. Okay, otitis media can be caused by bacteria like Streptococcus pneumoniae, Haemophilus influenzae, and Moraxella catarrhalis. We're on the third anatomical site. We have the eye. So this is the basic anatomy of your eye. You have there your eyelid, the pupil, the sclera, and the iris. And this is the inside of the eye. Okay. Your conjunctiva, let's proceed. Conjunctiva is the thin, tough lining that covers the inner wall of the eyelid and the sclera. It's actually a transparent mucous membrane that lines the eyelids. Conjunctivitis is an infection or inflammation of the conjunctiva. It can be caused by virus like adenovirus and bacteria like what we have here, Haemophilus aegyptus. So I'm showing you an example of pink eye conjunctivitis. This is how it looks like. It's caused by a bacteria, Haemophilus aegyptus, which is formerly known as Coxswax bacillus. This bacteria is responsible for this pink eye conjunctivitis, which is said to be highly contagious. So next is keratitis. Keratitis is an infection or inflammation of the cornea. Cornea is the dome covering over the iris and the lens. As you can see, the cornea is already covered with white corneal plaque. Your keratitis can be caused by bacteria or fungi. The example that I show you is an example of fungal keratitis. Fungi that causes keratitis might include Aspergillus and Candida species. Next is keratoconjunctivitis. This time, this is an infection that involves both the cornea and the conjunctiva. Okay, so this is how it looks like, your keratoconjunctivitis. Next Next is the respiratory system. It's divided into the upper respiratory tract and lower respiratory tract. The upper respiratory tract includes the paranasal sinuses, nasopharynx, the oropharynx, epiglottis, and the larynx or your voice box. So it's in the picture as you can see. Then the lower respiratory tract includes the trachea, the bronchial tubes, and the alveoli of the lungs. The alveoli is where the exchange of gases took place in the lungs. Okay? Your indigenous microbiota or the normal flora of the upper respiratory tract may cause opportunistic infections of the respiratory system. These are actually pathogens. When you say opportunistic, these are pathogens that did not directly or usually cause disease to the body, but they will lead to infections to immunocompromised patients or people with underlying conditions or diseases. Those are the opportunistic pathogens. So, infectious diseases of the upper respiratory tract, like colds and sore throats, are more common than infectious diseases of the lower respiratory tract. However, the lower respiratory tract infections are the most common cause of death from infectious diseases. There are several bronchitis is next is bronchopneumonia. Bronchitis is an next is the respiratory. Bronchitis is an inflammation of the mucous membrane lining of the bronchial tubes. It is most commonly caused by respiratory viruses, but it can be also caused by a bacteria. For example, a bacterium Bordetella pertussis. This is responsible for that whooping childhood disease. It's often associated with bronchitis in infants and preschool children. Bronchitis is characterized by cough. There is also sputum and a croup. When you say croup, it's a barking, cough, and hoarseness. So, bronchitis again is an inflammation of the mucous membrane lining of the bronchial tubes. Next is bronchopneumonia. Next is bronchopneumonia. Bronchopneumonia is a combination of bronchitis and pneumonia. And we have also here epiglottis. Epiglottis, by the way, it's a flap of cartilage which acts as a gatekeeper or a guardian of the airways to prevent food particles from entering the lungs. So it opens and closes once the air enters the larynx. Because in your pharynx or in your throat, the air and the food particles are mixed or combined together. But they have to go separate ways, like the food has to go to the esophagus and the air has to go to the larynx, and in that way your epiglottis functions as a gatekeeper to allow only air passing through the larynx and then eventually to the lungs to prevent food particles from entering the lungs. So that's one function of your one major function of your epiglottis. So epiglottitis, it's the inflammation of the epiglottis. It may cause respiratory obstruction, especially in children. It's frequently caused by Haemophilus influenzae type B. Your epiglottitis is usually associated with bactericidal infections. Aside from Haemophilus influenzae type B bacterium, it's also caused by other organisms like streptococci and staphylococci. Next is laryngitis. Your laryngitis is the inflammation of the mucous membranes of your larynx or the voice box. Laryngitis is an upper respiratory tract infection. It's usually associated with the common cold or influenza syndromes. Infections here have identified that laryngitis are associated with methicillin resistant Staphylococcus aureus and Candida species. Next is pharyngitis. It's an inflammation of the mucous membrane. So this next is pharyngitis. It's an inflammation of the mucous membrane and underlying tissue of the pharynx or the throat. Most pharyngitis are caused by viruses. Pharyngitis is referred to as sore throat, and strep throat if the pharyngitis is caused by Streptococcus pyogenes. Though Streptococcus pyogenes is commonly associated or publicized, but pharyngitis again is most commonly caused by viruses. Next is pneumonia. Pneumonia is an inflammation of one or both lungs. Alveolar sacs become filled with exudate, inflammatory cells, and fibrin. Okay, common causes of pneumonia are Streptococcus pneumoniae, Haemophilus influenzae, and Staphylococcus aureus bacteria, as well as viruses influenza A and B, parainfluenza virus, respiratory syncytial virus, and bacteria, again, Legionella pneumophila, Mycoplasma pneumoniae, and your Chlamydophila pneumoniae, and a fungus, Pneumocystis jirovecii. So these are actually the causative agents that will possibly cause or lead to pneumonia. Next is sinusitis. Sinusitis is the inflammation of the lining of one or more paranasal sinuses. So it's in the picture, the four different sinuses. So it's an inflammation of the lining of one or more paranasal sinuses. That's your sinusitis. So these are again the common cause. On, we have here oral cavity or the mouth. So your oral cavity, it's the most infections of the oral cavity are caused by members of the indigenous oral microbiota, meaning from the normal flora itself. Sometimes one member acting independently and other times several members acting together. So your oral cavity is a very complex ecosystem. According to Burton's study shows that there are 300 identified species of bacteria, both aerobes and anaerobes, in our oral cavity. Okay, your saliva contains lysozyme and an IgA and buffer to control the near neutral pH, which helps control the growth of opportunistic pathogens. Although several bacterial species, dental caries, although several bacterial species, such as the one listed in the slide, these organisms often interact to protect the oral surface. In other circumstances, however, they are also involved in the oral disease itself. So, as mentioned in the previous slide, the members of the indigenous oral microbiota sometimes they are the cause of the disease or the oral cavity infections. Dental caries, these are actually next is gingivitis. Dental caries, these are actually tooth decay or cavities. The most common cause of tooth decay is your Streptococcus mutans, which produces lactic acid as an end product in the fermentation of glucose. So we are very familiar. I guess most of us experienced this when we were young. So this is your dental caries. Next is gingivitis. Next is next is periodontitis. Next is gingivitis. It's the inflammation of the gingiva or the gums. Next is periodontitis. This periodontitis is an inflammation of the periodontium. In severe cases, tooth or the teeth loosen and falls out. So this is how it looks like. So this is how it looks like your normal tooth and the one with gingivitis and periodontitis. Oral diseases such as gingivitis, periodontitis, and trench mouth are collectively known as periodontal disease. Lastly, I just include here the thrush. Thrush is caused by can be caused by Candida species that can also invade the oral mucosa. This is observed among immunosuppressed patients, including very young infants that may develop oral candidiasis called thrush. This is a common finding again in patients with acquired immunodeficiency syndrome and immunosuppressed patients. Thrush can actually extend to produce pharyngitis, and it is suspected if whitish patches of exudate on the area of inflammation are observed on the buccal cheek or the tongue as well as the oropharynx. And again, it can extend to pharyngitis or esophagitis. So, lastly, on oral cavity, these diseases are the consequences of the following microbial activities. Number one, formation of dextran. It's a polysaccharide by sugars from streptococci organisms. Next is acid production by lactic acid producing bacteria. Third is deposition of calculus by actinomyces. And lastly, the secretion of inflammatory substances or the endotoxins by Bacteroides species. So other etiologic agents, you have Echinella corrodens, Bacteroides fragilis, Fusobacterium, and Actinomyces israeli. So we're already in the we're already in the gastrointestinal tract infectious diseases. So the alimentary canal is also called the GIT or gastrointestinal tract. It's a continuous muscular tube that winds through the body from the mouth to the anus. The organs of the alimentary canal are the mouth, pharynx, esophagus, stomach, small intestine, and large intestine. And then the large intestine leads to the terminal opening or the anus. Most of the microorganisms ingested with food are destroyed in the stomach and duodenum by the low pH, and that is 1.5, so that's very acidic, and are inhibited from growing in the lower intestine by the resident microbiota or the normal flora. This mechanism is called the microbial antagonism. They are then flushed from the colon during defecation along with large numbers of indigenous microbes. This is one reason that when you examine a stool sample under the microscope, you'll be able to see many or abundant of bacteria. So we have here the gastrointestinal tract infections. First is colitis, that's the inflammation of the colon. So, in particular, that's actually your large intestine. So I have an example here. It's actually a pseudomembranous colitis caused by Clostridium difficile bacterium. This can follow the use of broad spectrum antibiotics, which can actually wipe out part of the normal intestinal flora or your indigenous microbes in the intestine, allowing pathogens to infect and invade the colon instead. This also releases a toxin that are cytotoxic to the colon and also toxins that causes diarrhea. Next is diarrhea. So as you can see in the picture, the guy says, "It's okay, I've got diarrhea." So that's only a humor, but it makes sense, okay? Diarrhea is an abnormally frequent discharge of semi-solid or fluid fecal matter. So diarrhea is commonly caused by bacteria, usually from foodborne pathogens or food poisoning, like staphylococcal food poisoning, for example. Next is dysentery. It's frequent watery stools accompanied by abdominal pain, fever, and dehydration. The stool specimens this time may contain blood or mucus. So, dysentery can be caused by a Shigella species. It can be also caused by a protozoa, your Entamoeba histolytica. So that's bacillary dysentery and amoebic dysentery. Moving on, enteritis is the inflammation of the mucosa lining of the stomach and the intestines. Hepatitis is the inflammation of the mucosa lining of the intestines. So we are moving on. Enteritis is the inflammation of the intestines, usually referring to the small intestine. Gastritis, inflammation of the mucosal lining of the stomach. Gastroenteritis, inflammation of the mucosal linings of the stomach and intestines. Hepatitis, inflammation of the liver, usually the result of viral infection, but can be caused by toxic agents as well. So what are other etiologic agents that causes gastrointestinal tract infections? You have Campylobacter jejuni, Escherichia coli, Salmonella species, Shigella species, Staphylococcus species, Yersinia, norovirus, and adenovirus. So we are now in the genitourinary system. It is composed of your urinary tract and the genital tract. But first, we will have the urinary tract. So your urinary tract consists of kidneys, your ureter, bladder, and urethra. Your ureter is a tube that carries urine from the kidney to the urinary bladder. Your bladder is a hollow muscular organ in the lower abdomen that stores the urine. Urethra is a duct that delivers urine from the bladder to the exterior of the body through or during urination. Okay. Urine is an ultrafiltrate of blood, and normally urine is a sterile fluid. Often, UTI are characterized as being either upper urinary tract infection or lower urinary tract infection. So, UTI are characterized as being either upper UTI and or lower UTI. It depends on the anatomical site. For upper UTI, it includes infections of the kidneys. It's called nephritis or pyelonephritis, and the ureters, that's ureteritis. Lower UTIs include infections of the urinary bladder or cystitis, the urethra, urethritis, and in men, the prostate, prostatitis. So the anatomy of the female urethra is of particular importance to the pathogenesis of UTIs as well, because female urethra are shorter than that of males, and they also lies close proximity to the anus, which is warm, moist, and these are actually teeming with microorganisms. Because of this, females are more likely to have urinary tract infection. In addition, sexual activity can also increase chances of bacterial infection in the female urethra. For males, incidence of UTI infections increases after the age of 60 when the enlargement of the prostate interferes with the removal of urine from the bladder. And by far, the most frequent cause of UTI is your Escherichia coli, especially the uropathogenic E. coli. So these are the different terms of urinary tract infections. Cystitis is the inflammation of the urinary bladder. It's the most common type of UTI, and the most common cause is your Escherichia coli. Other etiologic agents are the one listed. Next is nephritis. It's the general term referring to the inflammation of the kidneys. Pyelonephritis is the inflammation of the renal parenchyma. Again, E. coli is the most common cause of nephritis and your pyelonephritis. Next is urethritis. It's the inflammation of one or both ureters, either caused by the spreading of infection upward from the urinary bladder or downward from the kidneys. And then you have urethritis. It's the inflammation of the urethra. Pathogens are usually transmitted sexually. So the most common cause of urethritis is the bacterium Chlamydia trachomatis. But Neisseria gonorrhoeae, urea plasmas, and mycoplasmas can also be caused. Urethritis that is not caused by Neisseria gonorrhoeae is often referred to as a non-specific urethritis or non-gonococcal urethritis. Lastly, prostatitis is the inflammation of the prostate gland. It's um, most often prostatitis is not an infectious disease. Okay, but if it is caused by a pathogen, then the pathogen may be a bacterium, a virus, a fungi, or a protozoan. So therefore, Escherichia coli is the most common cause of cystitis, nephritis, nephritis, and pyelonephritis, while Chlamydia trachomatis is the most common cause of urethritis. Other etiologic agents could be Klebsiella species and other Enterobacteriaceae, Staphylococcus saprophyticus, and Enterococci. So we're already in the so the normal flora or indigenous microbiota are found near the outer opening of the urethra for both males and females. In addition to that, the female genital region supports the growth of many other microorganisms. Okay, that includes lactobacillus, staphylococcus, streptococcus, enterococcus, neisseria, clostridium, and the rest that is in the slide. So the destruction of some members of the vaginal microflora can lead to an overgrowth or superinfection of other members. For example, you're taking an antibiotic that actually kills a normal or a resident flora lactobacillus. It will allow occupancy or super infection or overgrowth of other organism like Candida albicans that will actually cause yeast vaginitis. So these are actually affected by factors like the pH, the estrogen, to maintain the balance of these microbes. And the three most common causes of vaginitis in the United States are Candida albicans and a protozoan, the Trichomonas vaginalis, and a mixture of bacteria. So these are the different terms or terminologies relating to genital tract infections. First, we have Bartholinitis. It's an inflammation of the Bartholin's ducts in women. Then you have cervicitis, inflammation of the cervix. Endometritis, inflammation of the endometrium. Epididymitis, inflammation of the epididymis. Uh, um, and next is pelvic inflammatory disease. That's the inflammation of the fallopian tubes. And vaginitis, inflammation of the vagina. Vulvovaginitis, inflammation of the vulva. The vulva is the external genitalia of women and as well as the vagina. So vulvovaginitis, inflammation of the vulva and the vagina. So what are sexually transmitted diseases or STDs? These are any of the infections transmitted by sexual activities. STDs affect not only the genital tract but can also involve the skin, mucous membranes, blood, lymphatic, and digestive systems, and many other anatomic sites. So epidemic STDs includes AIDS, that's acquired immunodeficiency syndrome, which is very rampant. You have also chlamydial and herpes infections, gonorrhea caused by Neisseria gonorrhoeae, and syphilis caused by a spirochete bacterium, that's your Treponema pallidum. We are now in the circulatory system. Your circulatory system is composed of cardiovascular system and the lymphatic system. We will have first the cardiovascular system. It is composed of the heart and the blood vessels. What are the blood vessels? It includes the arteries, capillaries, and the veins. Your blood, on the other hand, it is composed of the liquid portion, that is your plasma, plus the various cellular elements, your red blood cells, white blood cells, and your platelets. The function of your heart, it supplies oxygen and nutrients by pumping blood all throughout the body. It also removes carbon dioxide and wastes from the blood. So take a look on this picture before we'll proceed to the next slide. This is the basic anatomy of your cardiovascular system. So these are the different terminologies relating to cardiovascular system infectious diseases. But before we will proceed, let's first have a quick recall of the different walls or layers of the heart. You have the endocardium, myocardium, and the pericardium. Your pericardium, it's the doubled wall membranous sac around the heart. And your myocardium is the muscular walls of the heart. The endocardium, it's the innermost wall of the heart. It's the endothelial membrane that lines the cavities of the heart. If the inflammation is in the endocardium, that is called endocarditis. If the inflammation is in the myocardium, that is called myocarditis. And if the inflammation is in the pericardium, that is called your pericarditis. So normally, blood is actually sterile. It contains no resident microflora or no normal flora. The presence of bacteria in the bloodstream is known as bacteremia, which may or may not be a sign of disease. Transient bacteremia, on the other hand, it is the temporary presence of bacteria in the blood. Often, this is a result from dental extractions, wound bites, and damage to the intestinal, respiratory, or reproductive tract mucosa. Even aggressive or too much brushing of your teeth, which causes bleeding of the gums, can lead to transient bacteremia. Other conditions in which bacteria are only transiently present in the blood includes manipulation of infected tissues, devices, or instrumentation inserted through contaminated mucosal surfaces, and also surgery involving non-sterile sites. Normally, bacteria are cleared in the blood by the phagocytes, but when instances like this happen, that the bacteria or the pathogens outweigh the capability of your immune system, that's the time the bacteria multiplies more rapidly. So that's the time that septicemia already occurs, especially to patients who are immunocompromised or more susceptible than the normal patients. A septicemia patient experiences chills, fever, and prostration, or extreme exhaustion or tiredness, and has bacteria and or their toxins in the bloodstream. These are caused by the presence of the invading microorganism and the toxins produced by this microorganism. So, the older the patient is, the greater the risk and the rate of the mortality as a result of septicemia. Next is your lymphatic system. It is composed of the lymphatic vessels, the lymphoid tissue, including the lymph nodes, tonsils, thymus, and spleen, and lastly, the lymph. The lymph is the liquid that circulates through the lymphatic system. If blood circulates through the blood vessels, your lymph circulates through the lymphatic system. The lymphatic system contains many lymphocytes. So let's familiarize the different terms related to the lymphatic system infectious diseases. When you say lymphadenitis, it's inflamed and swollen lymph nodes. Lymphadenopathy, it's the disease lymph nodes, and lymphangitis, that's inflamed lymphatic vessels. So lymphatic system infectious diseases can be caused by your bacteria and viruses. But what I'll show you in this slide, this is a lymphatic filariasis that is caused by a parasite. These are actually your tissue nematodes, your Wuchereria bancrofti, Brogia malayi, and Brogia timuri. When they're adults, lodge in the lymphatic system, it actually causes diseases like lymphadenitis, lymphedema, and lymphangitis, and eventually, in worst cases, it can lead to elephantiasis. So the black and white picture here in the slide is a picture of a patient suffering from elephantiasis caused by this filaria or tissue nematodes. The nervous system is composed of the peripheral nervous system, which consists of the ganglion and the nerve, and the other is the central nervous system, which consists of the brain and the spinal cord, as well as the three meninges that lines or covers and protects the brain and the spinal cord. Your nervous system has this blood-brain barrier. This is a barrier that is selective. It does not allow entry of large molecules like the cells as well as microorganisms from entering the brain. So these are the three meninges of the central nervous system. You have the pia mater, which is the inner layer, the arachnoid, the middle layer, and the outer layer, which is a tough outer layer called the dura mater. So these meninges are very important. It serves to protect the brain and the spinal cord from any mechanical trauma. It also supports the blood vessels and form a continuous cavity through which the cerebrospinal fluid passes. So these are the three meninges of your central nervous system. So these are the different terms related to central nervous system infectious diseases. First, we have encephalitis, which is an inflammation of the brain, and encephalomyelitis, an inflammation of the brain and the spinal cord. Then you have the meningitis, inflammation of the meninges that surrounds the brain and the spinal cord. Meningoencephalitis is the inflammation of the brain and the meninges. And lastly, myelitis, inflammation of the spinal cord. So meningitis is the inflammation of the meninges, the three meninges that I mentioned in the previous slide. It can be caused by a lot of factors, including poisons, drugs, and reaction to vaccines, and also can be caused by a pathogen. If it is caused by a pathogen, it might be because of a virus, a fungus, a bacterium, or a protozoa. So as shown in the table, these are actually the different causative agents of meningitis. First, we have the bacterial meningitis. You have here Haemophilus influenzae, responsible or more commonly associated um, in meningitis among children. You also have Streptococcus pneumoniae among the elderly people, Neisseria meningitidis among the adolescents, and Streptococcus agalactiae among the neonates. Other causative agents include Escherichia coli and other members of Enterobacteriaceae and Listeria monocytogenes. Early symptoms of bacterial meningitis includes fever, headache, stiff neck, sore throat, and vomiting. Then neurologic symptoms of dizziness, convulsions, minor paralysis, and coma occur. Death may result within a few hours. Actually, this is in your SAS module 25. Next is fungal meningitis. These are the causative agents that will cause fungal meningitis. Cryptococcus This is your Cryptococcus neoformans. You also have Histoplasma, Blastomyces, Coccidoides, and Candida. Viral meningitis, you have echovirus, Coxsackie virus, and lymphocytic choriomeningitis virus. These are only few of the causative agents listed. And as well, also your viral meningitis is referred to as aseptic meningitis because in about 50% of the cases, the pathogen cannot be identified. Lastly, you have parasitic meningitis. So one example I have here is a primary amoebic meningoencephalitis. This is called PAM, caused by Naegleri fowleri. This is actually a very rare meningitis, but this is a parasitic meningitis. So lastly, we have here opportunistic infections. This refers to infections that do not usually cause disease to healthy individuals, or if they cause diseases, it will be only mild infections. However, they are more likely to cause diseases to immunosuppress or compromised patients. Those patients also with underlying clinical conditions. So if your immune system is very low or if you are an immunosuppressed individual, you present more opportunities for these pathogens or these microbes to invade your body, your system, and eventually cause a disease. So listed in this slide and the succeeding slides are the different opportunistic infections. So you may read and take a look on these slides. This is the end of our lecture. Thank you for listening, class. So this is just an overview of the different human infectious diseases. We will still tackle each of the microbes in the later lectures. So thank you so much and have a good day.